I'm Dr. Kevin Brader. I'm a gynecologic oncologist, and I'm currently with the University of Michigan Health West, based in Grand Rapids, but I also work here in Holland. Well, I chose oncology. I was touched by this when I was young. I had a number of family members get cancer when I was in my, a child and in my teens, and then my mother got breast cancer when I was 18 and died when I was 20. And so what happened with that is I believe that she did not get the appropriate care. So it's very important to me. I've made a commitment that women get the appropriate care no matter what the situation with their cancer, because then you can live with it. Whatever the outcome is, at least everything was done correctly and the best effort was made. So I think it's just terrible when things are not done right and somebody could have survived the cancer. So that was one of my main motivating factors for that. Well, I think it's most important that with patients to see them as people, and I grew up on a dairy farm, and so all my family are just regular people. I'm the only doctor in the family, so I think it's important to see that you're seeing not a disease, you're seeing a person who has this whole other life, and that you have an appreciation for their life. And I think if you do that, and you can't just do it, you have to really feel it, but that's the key, because the relationship with the patient in cancer treatment is extremely important. Well, I think what's important is that, this is I'm always surprised Grand Rapids and this whole Holland area is a major part of Michigan, and we should offer top-level care that you would get in a tertiary center right here. So I think it's important that there's nothing I really feel like we need to send somebody to another facility for, and that's the way it should be, because people it's important that they stay home if they can, as close to their own home and their comfort zone during all this. And so, coming to Holland, I wanted to come to Holland and see patients here and operate at Holland Hospital for quite some time, because it can be scary going over to Grand Rapids, even though to me it's not a huge city. There's construction and all that, and people really feel intimidated by that. So I started seeing patients in Holland maybe 5 years or so ago, and I've been operating at Holland Hospital for longer than that. But there's not anything that I won't do at Holland Hospital that I would do somewhere else. It's very high-level care, anesthesia, the surgery team, and all that. So I think that's important to go where the patients are. And that's something I learned early in my practice when I practiced in Southern California, that's what we did. I have a real commitment to seeing patients almost immediately when they are referred to us. I try to see somebody within a week generally. And if that means going back and seeing somebody now, or at the end of the day, or after hours, I think that's very important. That's that level of care, because people are afraid, and they want, even though it wouldn't hurt to wait a little while for their cancer, they want a plan. And so I don't think that's something you get other places. It can take weeks to months to get referrals. And so there's really nothing we can't do in our program, from the whole gamut of treatment for women's cancers.